for what is the original plan, what is the Medicare Advantage plan, and what makes the difference. Okay, and then we get more detail. This is a quick look. Okay, and then this is more details in each chapter. What they talk about, the more detail than in your book. This to the section, okay. And on the page 4 of your book, it tells you what is new in this year and what's the most important you get into it. Of course, you see the party, and for the donut holes area, probably some of you are aware of what is donut hole. We cover it later on. And the basic concept for the Medicare, we are getting step by step into it. The Medicare is the original plan and Medicare Advantage plan. What is original plan? Well, you work in this country over 10 years, which is 40 quarters, then you automatically qualify, and not just work. You have to pay for your Social Security tax. A lot of people, even they work in the government. I had a friend, he worked in the Alameda County, and he yelled, he said, how come I don't get the Medicare Part A? Because, you know, at the time, some people would say, I don't want to pay the Social Security tax. They decide not to pay, so you don't get covered, you don't get benefit. So whoever pay the Social Security tax, very important that you secure yourself for the Part A. And what is the Part A? Part A is for the hospital. If you get surgery, then it's covered under the Part A. So be very careful. You have to pay your Social Security tax if you're going to live in this country. And Part B, you have to buy it through the government, and then that is the hospital, and that is an outpatient doctor visit. Okay, so this is one hospital surgery, this medical doctor visit. And then you go to the Part D. This all back into 2006, year 2006, and then the Medicare say, hey, everyone need to subscribe the Part D prescription drug, and then they recover, you know. Most of the people after 65, they really take lots of medicine every year. And I had my co-worker, and he and his wife, every month, the medicine would cost over $2,000. It's a lot of money, yeah. If you don't have the Part D, you really, you know, cost you a fortune. And then because the Part B only covers you 80% whatever the doctor charge, so there's a gap, and you have to think about how you're going to take care of the gap. So there's a supplement. So this is how it works under the original plan. And then year 2006, the Medicare they designed a new program. They say, well, maybe there's another way to save you some money for the Part C. Part C is a combination of Part A and Part B together. And under this Part C, there's about 5 organizations you can remember. The first one is the HMO. Like Kaiser is a typical sample for the HMO. But today, HMO is a bit different now. You can have a group of the doctor, and then your hospital join together. Then you have the primary care doctor, the specialist care doctor, and all this together you can form a HMO. So it's different. And Medicare, it's very important if you sign up the Medicare Advantage plan, you have to make sure whether that plan is available in your area. I had a friend, he came from Texas. He told me, John, I have a Medicare Advantage plan. I said, where did you sign this? Texas. I said, you live in San Francisco Bay Area. It will not cover you at all. Because, that Medicare Advantage plan, especially the HMO, just like a Kaiser, if you go to the one city, one area, and it's not covered. So every county makes a difference. In case you move from San Francisco County, if you move to Alameda County, your plan is changed. Okay, so that is very important concept. And then most of the time, Part C, they also include the Part D most of the time, but not necessary. Okay, so Part C, you cannot say this is equivalent to the supplement or Medicare Gap. It's not exactly the same because the supplement, they will waive almost all your copayment, all your deductible in that year for the supplement. But Part C will not waive that. You still have to pay some copayment. For example, you go to Hsieh, right? Hsieh will cost you for the registration fee, maybe for every visit, maybe $15 or $30. It depends on the area. Okay, so but some people explain Part C equivalent to Medicare Gap or supplement, which is wrong. Okay, that's a very important concept. And Part D, if your Part C doesn't cover the Part D, you have to buy separate, individual the Part D. So, and this one, who pay first? That's also a very important concept. If you work for a company and you retire and you carry on your original company's group plan, group health plan, and then which one pay first? Just remember, if you're retiree, okay, you retire from previous work, and you subscribe to the Medicare already, and your Medicare will go first. But for those companies, if, for example, I'm still working and I'm covered by the cover the group plan of my company, then my company, if that they have employed over 100 people, they automatically go first. It's a priority. So Medicare has a very strict rule, say which plan will go first. So on the page 22, they will tell you, on the book, page 22, they will tell you which one pay first. Okay. And this is a very detailed for the preventive service. On the page 51, this is very interesting. They ask you to check. Of course, you don't need to use it now, but for all the senior, they have to follow this on the page 51. They invite you to check it by yourself. Have you done this year? That's your right. Don't miss it. Okay. Yeah, I actually translate this into the Mandarin, so that help my community to understand that. And then that's the choice. I pretty much covered for the previous screen to say, how you make the decision to choose either the original plan or Medicare Advantage plan. And the important concept is that Medicare Gap. The rule of thumb is that if you're affordable, it's Medicare, the Medicare Gap supplement plan is better because there were lots of deductible co-payment for all that charge. And when we go to the details of coverage, I will explain to you. And this is a Medicare Gap or supplement plan they have from the A to the KL. Okay. Most of the people, they choose the F plan because the F plan, you see, it's here. The waiver, the Part A is deductible, and we go to the details, how much deductible every year, how much co-payment, and also the Medicare Part B, and also the blood, and very detailed. This you can see on the page 65. Okay. And of course, the Part D in Alameda County, there's about 55 plans. So you don't really know which one is good for you. So you really need to sit down with a licensed person and to help you to identify which plan is really for you. For example, I don't really take any medicine myself. So which plan I should take? Then they will help you to locate it. And like I mentioned earlier, my colleague, and he and his wife, they use about $2,000 of the prescription drug. So which plan they should choose. So that we tell you. So this is very important. You have to really understand what is a party, how it works. And then the party, of course, there are some rule, and then say if you think most the basic concept is that you had a generic drug and you had the brand name drug, right? And for this two drugs, which one is more suitable to you? Someone say, well, I prefer the brand name drug. Someone say, well, I can take.
Okay, we'll kind of get started. So, my father can't get enough of the microphone, so there's one last thing to talk about. So, and I'll introduce Jeff.
So, during the break, I had a couple of questions, and I want to share with you how to take care of the long-term disease or chronic disease in the community. As I mentioned at the very beginning, that we had a local organization called the Chinese Health Community Health Association, and this association we actually network with the city of Fremont. So you go to the city of Fremont, and this is a website for city of Fremont, and under the program, and you can see this lots of organization. Then you can go to Indian ICC, because most of you from the Indian community, and this is the last event we have for the graduation in training inside the city of Fremont. So you can see the variety of the Asian community. And then there's a program, each community conduct the chronic disease cell management program, which is about 15 hours program, and all the community members can sign it. It's free of charge, no cost. And as a leader, I'm one of the leaders, we have to receive the training through the Stanford University. And after you train, then you go back to the community to teach to the community member. 15 hours. Each week is 2.5 hours, so it's a six week. And 6 weeks, every week you had assignment. The good thing for the program is to help the patient to build up your confidence. Okay, most of the people, once they suffer from the chronic disease, they lost confidence. They lost the interest for everything. I just tired, faulting, and then cannot do whatever I used to do. Okay, but that program is really helpful to the community, and you can check this website, and you can talk to the Indian community of 3 groups. One is the Muslim group, one is the Sikh group, and one is the ICC Indian Community Center. So there's 3 organizations available in your connection. So that's it.
Thank you. Thank you.